Hey everybody, welcome back to my channel, Second Act Cat RN. And something that has been on my mind lately that I wanted to talk about is something I've experienced at many different facilities. And I think this comes into play when talking about a second act, especially for nurses going into, say, leaving a full-time nursing job later in life and starting maybe a PRN job or full-time, part-time, even a full-time nursing job that you're going into as your second act. So that is nurses who have to provide their own supplies, such as blood pressure cuff, thermometers. We bring our own stethoscopes most of the time. Most nurses do. I have my own stethoscope that I prefer. It's a very nice one, so it's a quality one. And the issue I have with nurses that have to provide their own supplies is if the facility does not have them, and in most cases, where I've worked at several facilities, these items, blood pressure cuff, a Dynamap, which is a rolling machine that monitors vital signs, and if places don't have a Dynamap, nurses usually have to bring their own supplies. A lot of times you'll be provided a blood pressure cuff, but not always. A lot of times you have different size arms, people have different sizes, so one blood pressure cuff does not fit every arm size. So for nurses to not have these items available at work, to me presents a huge problem, because if a nurse was unable to purchase her own, and honestly, my feelings are that nurses should be provided these supplies by their employer, because if you are required to document and assess these patients and report to the doctor or the provider so you can keep an eye on the health and safety of these patients, you must have an availability of these needed items. And if you don't, and a nurse is not able to get their own, or shouldn't have to bring their own supplies, you should be provided those supplies. But for those nurses who won't or don't have these supplies, you don't have any then to monitor these patients. Years ago, when I was working on a unit, we had a patient who had a very high fever. And at the time, COVID, the big to-do about COVID and when it was really hot and going on, that time had elapsed and we were later, a couple of years down the road. So we weren't considering COVID, bottom line, because we were past the majority of those days. And then it started creeping back in. So at that time, in our mindset, many of us, supervisors, providers, we weren't thinking about COVID. So this lady had a very high fever and she was very lethargic. She was elderly. So I went around looking for a thermometer because I didn't have my own. And I had a temporal thermometer, but if you've ever used those, you can get 20 different readings 20 different times back to back. So to have a regular thermometer, we didn't have those. And I went looking unit to unit to unit, and the one I found one, and it was an oral thermometer, but I needed to do a rectal temperature. So because I couldn't find one, and if you know, as a nurse, you know those are different. The rectal one has a longer bulb because it goes further up. So the one I found was an oral thermometer, and they were the cheap kind. They just did not work very well at all. And I was told by a supervisor, just use that. So I used it, and this patient they transferred her out to the hospital. She ended up with COVID. And then I ended up getting COVID the following week or a few days later. So anyway, the issue with not having these supplies, let's say I couldn't find a thermometer in the facility when this woman presented with a high fever or presented with symptoms of a high fever. I would not have been able to adequately assess and determine. I would have just thought, oh, she's not feeling good, she's a little warm. She had a very high fever. So we run the risk of harm to the patients by not being able to assess them quickly and being prompt about things and being diligent. When I have to provide my own supplies, I have to then share those with the CNA on my unit, or even CNAs on other units. They've come to me and said, can I borrow your stethoscope, or can I borrow your blood pressure monitor, your blood pressure cuff? Can I borrow your pulse oximeter? And these things are necessary things that we use day to day to day. We use them on every patient, whether they're presenting with symptoms or not, because you want to be ahead of the game and keep their monitor them so that you're up to date and can catch anything that comes along that might be detrimental to their safety or their health. So for the nurses or even the CNAs to have to provide their own, that to me says management doesn't care about me. They don't care about the patients. They care about the bottom line, because they're not willing to spend that extra money to provide these supplies and help the patients, help the nurses to be able to assess the patients in the best way. So I've had CNAs borrow, or even other nurses borrow, my blood pressure cuff, and there have been times I haven't gotten them back. So I've had to go find them because I needed to do a blood pressure. You have medications that are due, that some of those meds are based on blood pressure. Some of those meds are based on heart rate. So you can check a heart rate without any tools, but if I want to be accurate and I have to check an apical heart rate, I can do that with a stethoscope. But if they don't provide stethoscopes and you don't have your own, it's kind of a guessing game. You're kind of doing the best you can, but you're not doing all that you can. And to me, it shortchanges the staff, the nurses, the CNAs, because you're not providing a full spectrum of everything they need in order to do their job effectively and the right way. So it tells me that the facility or management or whoever is in charge of providing these or making the decision to not provide them, for them to not do that, they've not worked the unit. They don't understand why you need these. They may say they understand, they may be nurses, but somebody has gotten to them and it's all about the bottom line. It's all about how much money they can save. When you're providing these things for the nurses, to me, you're showing these nurses that you respect them and you want them to take care of their patients. You want them to do the best job possible. I don't want it to be that I was not able to assess my patient correctly and then something happened and that's on me. They say in nursing school, they say, you know what to do. If you fail to do something that you know to do, and if that causes harm to a patient, or if it leads to something that could cause harm to a patient, you are responsible. You should have used your nursing skills, your critical thinking skills to get that information, to obtain that assessment as best you can. But if you don't have the supplies, you can't do that. You have to rely on yourself. You don't get compensated or reimbursed for spending the money on these items that you have to have day to day. They do not give you a refund or a reimbursement on your check. You spend the money, people steal accidentally, maybe on purpose, items disappear. So if you're loaning out your blood pressure cuff to every CNA on every hall because the facility doesn't provide them, or if you're loaning your supplies to other nurses, there is the chance that you won't get it back. They could be lost. Somebody could, have stuck it in their bag, their work bag, and maybe didn't think about it. Or maybe they thought about it and they thought, really would like to have this. No one will ever know. And I won't have to be borrowing somebody's all the time because I already have one. That the facility, to me, it says that there is no respect for their staff or their patients. They may say there is, but when you think about that, if I go somewhere and I need care and I expect that facility will have the proper equipment. Let's say I need a chest x-ray or I need an ultrasound of the abdomen. And you assume these facilities will provide those. Those are larger pieces of equipment. It's not something I could provide myself. But if I go into a facility and I expect that that x-ray machine is going to be working, or they have one, they have access, and they don't, what if I need that diagnostic information right away? Or what if the doctor needs that diagnostic information right away, but they're unable to get it because they don't have those pieces of equipment? To me, that's the same thing as the nurse not having the required equipment to carry on the normal things that are expected every day with patients. You always do vital signs. Another thing is the scale. When you have to weigh patients, you have many patients that require a daily weight. They have an order for a daily weight by their provider. And if you have a broken scale, you don't have any scales, a lot of times we would have CNAs bringing their own and leaving them in the supply room or wherever they would go to weigh these patients. But if you didn't have that, you run the risk of CNAs making up a weight. If they are not able to have access to the proper equipment, and I've seen this happen, even a blood pressure cuff, a pulse ox, they will record just a random number. And then you're getting into dangerous territory because they may not know how that blood pressure is trending, and they make up a number, and it might be higher than what the patient usually has. So that alerts the nurse to contact the provider because their blood pressure has gone up. When in fact it did not. They were making something up because of the pressure to chart these vital signs, but not having the equipment available. And you can't always rely on borrowing a nurse's equipment because the nurse may need it for something else. I needed it for a lot of patients throughout the day. So I could not risk not having it on me because I needed it. I needed it to give different medications, as I said earlier. So anyway, my gripe, it's just a thorn in my side that nurses usually in a lot of cases are required, or maybe it's implied because they don't supply them. So they know the nurse is going to go, well, I'll just go get my own because they're not going to supply it. And I really need to do, the best care, give the best care to these patients that I can. So just the fact that it's a money thing in most cases with regard to the business, the bottom line of the business, I just think that's wrong. I feel like if I'm going to give care to the patient, if I'm going to be working at a facility, I need to have access to every bit of equipment or supplies that I need. And I don't like that I have had to provide my own supplies. So this video is just to vent about that and to see what your thoughts are. Do you feel like it's the facility's responsibility? Let's say you're working at a hospital. Do you feel like it's your responsibility to provide diagnostic equipment like blood pressure cuff, even a glucometer or a pulse oximeter, anything like that, thermometers? For some reason, thermometers are the hardest things to find in a facility. When you need one, they're gone. You just, or they don't work right. They're little cheap ones and they just don't work right. If I had my way, I would have an oral thermometer, the mercury kind, the old-fashioned kind. I would have those in every patient room. You can sterilize those, but I would have those provided instead of the cheap kind or the temporal ones, because I never get the same reading twice on the same patient at the same time, right after doing a temperature check and then doing it again. It's a different number. Their temperature fluctuates with a temporal thermometer. So I just wondered what you guys think. Do you feel like it's your responsibility, or do you feel like the facility should provide this equipment? So drop a comment below and let me know what your thoughts are. And, if you've gained anything from this video, or maybe it's just a venting video, really. But it's also kind of to educate you that when you start a new career, even at a later age, these are things to think about if you're going back into nursing, but a different facility, or you're changing from full-time to part-time or vice versa at a later age. You may want to have that facility provide their own. Do you want to do that at this age? Do you want to go through the process of having to spend that money and make sure you have the right equipment instead of the provider or the facility providing that for you? That should be, in my opinion, something every facility has an abundance of, so that you don't run out. If you start to run low, it needs to be ordered. You have to have that on hand. You must have that on hand, because you cannot depend on hoping you're going to find something to use and it's not there. So this, again, I'm just venting about this because it's, like I said, been a thorn in my side at several facilities where I've worked. And I feel like this is something that needs to be addressed. So all of you facilities out there, managers out there, pay attention, please. This is important. It's not worth skimping on. So please like, share, and subscribe, and I'll see you again soon.